It's good to be home. Many of you guys are itching to get out of here, go on rotation, to be done with boards, but you'll actually end up missing this place. Be happy to be back when you come back for callbacks and for things like this. Now I'm going to ask you guys to take a second, take a deep breath with me, and turn off you world on your phones. Zoom in as well. Because I know better than anybody else up on this stage, except for those two, what's inside your brain right now is a giant parasite eating through it, which is the thoughts of the board exam. And that anything that doesn't help you prepare for that right now seems like a waste of time. So I'm going to ask you to just trust me and be present with me here for maybe 10-15 minutes. Because there's some key things that are going to happen to you shortly that a board exam can't prepare you for. Many of you will remember my analogy of the white coat. And unfortunately, it's a little more challenging to design a speech on an extended analogy regarding the king. But you will still have that coat. And believe me, if you saw what was on my bed after I had to empty my coat to be able to get onto a plane, there are way more things in it during your third year. And it's way heavier. You'll be on many different services, with many different levels of expectation of you. And if you are self-aware, and you are the type of person that doesn't just take the exam and watch the information pass before your eyes, you will realize that you are very responsible for patients' care very quickly. You'll find that interns and residents are very tired and overworked people. And that if you miss a physical exam finding, somebody else may not find it. If you don't reconcile that medication list, it may not get done. If you zone out during a lecture, there's no going back and looking at it later that night at your leisure in your PJs in your bed. And there's no PowerPoint that will prepare you for delivering a baby. I went on rotations with the benefit of having absolutely no idea what I wanted to do when I grew up. So I went into each rotation earnestly trying to figure out whether this was something that I wanted to do. Now, I never really was interested in doing OB or gynecology. Nothing against it, it just wasn't something that I thought I would want to do. But I did know that I didn't want to be stuck in a situation where I was on an airplane, or out in the middle of nowhere, or in a church, and somebody stood up and said, "Is there a doctor here? We have somebody who's sick, or we have a mother who's giving birth to a baby." I didn't want to have to put my head down and pretend like I wasn't there. So I made sure that I could be at every possible delivery and every possible C-section that I could. And I had the honor of helping bring 35 babies into this world. And despite not having wanted to do OB-GYN, after I delivered my first baby, I quickly stepped away and called my mom. As many of you probably will. Because there's something very special about that, and being present for that. I wasn't supposed to be a joke. So, another thing happened while I was on OB-GYN that Dr. Heiser had warned me would happen before I was thinking that it would. And that was that someday, somebody's going to say, "Hey doc, we need this," or "You need to do this," and you're going to turn around, and there's not going to be somebody there standing behind you. Somewhere in the middle of these 32, or 35, excuse me, that happened to me. Babies don't come on a schedule, as anybody knows. They decide when they're going to come. And the hospital was very busy. The obstetrician was driving as quickly as he could from another delivery. ER doc was intubating a sick patient. And here I was in the room, scrubbed in, and I decided to ask the nurses, I need the chuck pad, I need this, I need that. And she just turned to me and said, "That's on you, doc." I said, "Oh, right." So, luckily I'd been paying attention. I prepared and saw that it was time for me to get ready, because unlike in the movies, there's a point in labor when there's not the whole mom grabbing the husband and cursing him out and a lot of talking and yelling. There's a time that comes where there's no more talking, and there's just breathing and pushing, regardless of what you tell mom what to do. And that's when you need to be there and be present and be ready. And as I delivered the head and waited for that very scary few moments between when the head is delivered and the shoulders have not, Dr. Lee popped his head in the room, looked around the corner as I delivered the anterior shoulder and the posterior shoulder, and said, "Oh, great," and turned around and left. And so, although there were many skilled people there that were perfectly capable of doing what I did, and that babies tend to find their way into this world just fine, regardless of whether a doctor is there specifically or not, the consequences of what could have happened had I not been paying attention for the many deliveries before that would not have been to my GPA. So when I say be present, what exactly do I mean by that? I had an experience, it was actually before before third year, somewhere late first year, second year, something like that, where I was setting up an informational talk with Dr. Harper. And he had gotten to me with the time that he could do it was going to be 2 o'clock Friday afternoon. We had no lectures that Friday afternoon after, I think, 11 o'clock. So being the student representative that I thought I was supposed to be, I emailed him and said, I'm a little concerned, is there another time we can do this? I'm afraid most students won't come because we don't have an afternoon lecture and they're not going to stick around. Can we accommodate another time frame? And he sent back to me 4 words, which was, "Go hard or go home." And I stared at those words and was a little confused. And so I wrote back to him, I'm not sure I know what you mean. And he was very patient and explained to me what he meant, which was essentially that the time has come where you are going to have to go out and get what information you want. And nobody's going to spoon feed it to you anymore. And that if you aren't willing to be all in all the time, the person that's going to suffer is you, and maybe even your patient. But if you are present, and if you are all in all the time, you will see some amazing things. I felt a man's heart start underneath my hands, only to watch him die 5 hours later. There is no lecture, there is no PowerPoint that can equal that experience. I also got to see a patient who came into the hospital very, very sick. She was septic, she had purpura all over her body, and was in DIC, which is disseminated intravascular coagulation. For those of you that remember what that is, and for those of you that don't know, it's just bad. It's bad. It's pretty much as sick as someone can be. And we came to the point where this was suspected meningococcemia, which if you don't know what it is, it's also very bad. But our patient came in, her CSF was clean. The initial labs were red. In the middle of the night, the patient had gotten antibiotics before the blood was drawn. The initial labs came in and we looked at them in the morning report, CSF clean, gram-positive cocci. So we were thinking staph. It's not meningococcemia. But as I've been there every morning at 5 o'clock in the morning at the ICU, I saw this patient. I said, this is not staph. me, I'm a third-year student, but that looks like the picture right out of Robin's pathology. So I told the intern and resident that were on that service, and they kind of agreed with me, but they had 15 other patients to deal with. They said, we'll go to the lab. So I went to the lab and learned a little something. I learned that initial reads are initial reads. And I learned that if a slide is read in the middle of the night, it's sometimes read by a tech, not by a microbiologist. And that the reason everybody in the microbiology lab was being very quiet that morning was because it was meningococcemia. And the patient had remained on every antibiotic that was necessary. We were able to tailor it afterwards. So there was no consequence to them. But there was great consequence to me, which was this is now my patient. And I was there every morning for about 7 days doing a neuro exam, head to toe, checking her pupils, checking the vestibulo-ocular reflex. For those of you that thought Dr. Manini's lectures weren't going to come back and haunt you, think again. And one day, as I was checking the pupils and the eyes, I left the lids open and began to listen to the heart and lungs, which were filled with fluid and sounds of a respirator. And her eyes just kind of stayed open and sort of rolled towards me a little bit. An expression came on her face that was sort of, who are you and what are you doing to me? All I could think to say was, hi. You don't know me, but I've been here every morning checking on you for about a week, and I just wanted to let you know I was rooting for you. Now, I don't know if these experiences will be experiences that you will have. I'm sure you'll have different ones. I don't know that these experiences were the ones that made me decide that critical care was what I wanted to do. I do know that they helped me decide what type of doctor I wanted to be. This is a time when you will not just decide what specialty you want to practice, but what type of physician you're going to be for your patients. Unfortunately, you'll hear a lot of criticisms of physicians about other physicians, specialties about other specialties. Some are true, some are false. Most of them are people just venting. And with luck, you'll find some physicians that you truly admire. And you'll also find some that you truly hate. My hope is that at some point during next year, you'll remember some of the things that I've said today, especially that all doctors are human, and that most doctors are just doing the best that they can, and the best that they can do for their patients. For the surgeon who's hurt and mean to you, but a great operator, he knows what he's good at. And he knows and can tell who's interested in what he's going to teach, and will take his time to teach those that he thinks are worthy, and not waste his time with those that aren't. For the internal medicine doctor that seems to admit every patient, or seems to keep them for longer than anyone else, he knows that this may be the only opportunity for that person to get the care that they need. He also knows that discharge patient home are the most dangerous orders a doctor can write. Finally, there's going to be another pin on that coat. And that's your name tag. I had an attending that told me, and all of us in morning report, that your name is the only thing that you'll carry with you for your entire life. It will proceed before you and stay after you, no matter where you go. There's no greater, for me, there's no greater compliment than for a patient, physician, a peer, to say, my mother is sick. Can you help her? Will you see her? That's the kind of doctor that I want to be. What kind of doctors will you